I have a poster at SOHO this year on Pelabresib from the Manifest trial. Now, this trial is well known to those who follow the field. It's been going on for a little bit, over 200 patients treated at this point. There are 3 arms of the trial trying to address the main subsets of patients or patient scenarios that you encounter. So arm 1 is Pelabresib alone in patients who've discontinued Ruxolitinib or who are not candidates for Ruxolitinib. And then arm 2 is Pelabresib added on to Ruxolitinib in patients having a suboptimal response to Ruxolitinib alone. And arm 3 is the JAK inhibitor naive population, where Pelabresib and Ruxolitinib are started as a combination from the get-go. So my poster is actually focused on arms 1 and 2, not 3. 3 is a separate poster. And this particular poster is looking at anemia. That's the focus of the poster, combining data from arms 1 and 2. So it's not a straight analysis of arm 1 or arm 2, which has been done in the past, but this is really looking at anemia across both of those arms. So each arm has 2 cohorts, and the cohorts are essentially defined by transfusion dependence. So 1A and 2A are transfusion dependent patients. 1B and 2B are transfusion non-dependent patients. So essentially, if you take the data as a whole, you see that the anemia benefits of Pelabresib are seen in all the 4 cohorts within these 2 arms. So to be specific, in 1A, which is Pelabresib alone, you see a 21% rate of transfusion independence. In 2A, which is the Pelabresib add-on to Rux, you see a 36% rate of transfusion independence. And while that is fairly impressive on its own, you also have very nice rates, 60 and 53 respectively in 1A and 2A, of a 50% or greater improvement in transfusion requirement. So you have 21% and 36% becoming independent. You have 60% and 53% having a 50% or greater reduction in transfusion requirements. And finally, if you look at those who are non-transfusion dependent or not transfusion dependent, which is 1B and 2B, you see some nice anemia improvements there as well. So in 1B, for example, the monotherapy, you see a 59% rate of improvement in anemia, which is defined as a sustained 1.5 gram improvement in hemoglobin. So you see that in 59%. In arm 2B, it is more modest. It's only 17%, which is a little bit of an aberration, I think, if you look at all the other data from the trial. But overall, very robust findings of anemia improvement. And anemia is certainly a very, anemia improvement is certainly a very helpful attribute of a new drug. I mean, given that it is added to its benefits in terms of spleen and symptoms. So, things like Myelofibrosis, Pelabresib seem to be drugs that can address all aspects of the disease. And I'll finally add that with the Pelabresib, also we see that translationally, we see that these anemia improvements are accompanied by an increase in erythrocyte precursors in the bone marrow. So perhaps, via the transcriptional downregulation that bromodomain inhibition brings about, you're seeing an increased erythropoiesis in the bone marrow.